GYN. I'm a board-certified obstetrician gynecologist, a wife of 23 plus years, and a mother to 3 awesome children. I am a 2-time best-selling author. I am a speaker, and through my videos and books, I encourage women to express their healthcare concerns and fears. That's one word. Concerns and fears, giving them a voice and empowering them to live their best lives, body, mind, and spirit. August is National Breastfeeding Month, and so today we're going to talk about the benefits of breastfeeding, aka why you should feed your baby off your natural tap. So, without further ado, here we go. So the benefits of breastfeeding. Did you know that in breast milk, there are hormones actually that stimulate the growth and development of your baby's gut? And how it works, that when you, as a mama who nurses your child, is exposed to a virus in your chest, like a respiratory virus, or in your gut, that there are actually immune cells in your breast that will make antibodies in order to be able to protect your child from the cootie bugs you've been exposed to, and that it contains white blood cells, anti-inflammatory agents, sugars, in order to be able to help the bacteria that actually live in your baby's gut so that it does better. So here we go. Facts. Only 1 in 4 babies in this country are exclusively breastfed. The thought process, the data suggests that at least if you do it, a minimum of 2 weeks makes all the difference in the world. Ideally, it would be preferred that you feed your baby for up to 6 months exclusively, nothing other than you. And then after that, you can still supplement up to a year if that's what you want to do with your own milk plus food that you add slowly over time. And that unfortunately, African American infants are 15% less likely than white ones to have ever been breastfed. So why would anybody do this? What are the benefits of nursing your child? As I mentioned beforehand, you get improved GI function. So your baby's gut, there are things specific to your baby inside this breast milk that actually help how well it works. So there are hormones that help it grow and develop and mature. There's a thought process that there are actually in mediators inside the milk that actually make the nervous system that runs through the gut tighten up and helps it function better. You actually, for breastfed babies, they actually have an improved immune function. It decreases the number of infections that they get. And long term, there is prevention of disease long term with moms who breastfed their babies. So here we go. Short term, you get a decreased number of ear infections, respiratory infections, GI infections like gastroenteritis, urinary tract infections, and in preterm babies, there's something called sepsis where you get this systemic infection and they don't do so well and they can die, and even something called necrotizing enterocolitis. Babies that are born early, their guts aren't ready to eat food. It sometimes breaks down. Hey, thanks for tuning in. Their gut breaks down and you actually have to have surgery to put the pieces back together. For pretermers in particular, breastfeeding makes a difference and decreases the risk for necrotizing enterocolitis. So long term, and tonight is just a PSA, basically, a public service announcement for breastfeeding and why you should do it. So that was the short term. Long-term benefits for nursing your baby are literally you decrease the risk for asthma and allergies, that you decrease the risk for obesity, slight decreased risk for obesity is what the data suggests. You decrease your baby's risk for childhood cancers long-term. There's a study that also suggests that you decrease your risk for sudden infant death syndrome with babies that are breastfed. Long term, there is a decreased risk for cardiovascular disease as an adult. There's some studies that say plus minus. What it looks like, in all honesty, and we're going to circle back to this, in pretermers, definitely your risk for something called, or your rates of CRP, C-reactive protein, which is this thing that's upregulated in people who have cardiovascular disease, and your bad cholesterol, your low density lipoprotein, definitely in people who are breastfed when they're preemies, it makes a difference long term. So basically, anybody who's ever nursed or pumped, if you put that milk in the refrigerator on the shelf and you come back, it separates, and it's got like a layer this thick of fat on the top, and then the rest is, the milk, the fluid itself, and whey and proteins and all that good stuff. Little babies have high cholesterol, but then when you get to become an adolescent, you actually have decent cholesterol, and the benefit of having been nursed carries you up till about age 41, and then after that, you straight on your own. Your mama gave you a running start, but you got to maintain in order to be able to keep your cholesterol looking decent. So there is also studies that suggest, hey, Brandy, I haven't forgotten about you. I meant to get with you. I haven't forgotten about you specifically. There's also studies that suggest that babies that are breastfed, it precludes malocclusion in English because your baby lined its jaw up on your breast, on your nipple. It actually makes a difference in how their teeth come into their mouth. So breastfed babies are less likely to have crazy overbites or underbites as a consequence of having been nursed. Long term, they have a decreased risk for type 1 diabetes and type 2 diabetes, and the studies suggest that they've been a little fuzzy neurodevelopmentally. So There's some studies that suggested in the very beginning that if you breastfed your baby, it made for smarter babies. And I would attest to that because by the grace of God, all my babies, they pretty tight. Thank you, Jesus. We nursed all of them. Different ones got different amounts of nursing, but they're pretty tight. They used to think that it was exclusively due to having been breastfed, but what they actually think is because of that closeness and this bond that you share, that ladies that breastfeed are more likely to put time and energy and attention to their children to begin with. So some of it may be breastfeeding, specifically this particular component called DHA or docosahexaenoic acid, which is found exclusively in breast milk, and what you've seen is within the last, I don't know, maybe 6-7 years, the formula company started putting it inside there because it's good for eye and brain development. It's also the thing when we tell people to make sure that they eat fish oil, that it's DHA and EPA are one of the two things that you find in fish oil, but it's good for eye and brain development. So the DHA makes a difference in how this brain is developed and what the smarts are about. There's also a suggestion that babies that are breastfed, have better hearing and that they have decreased behavioral issues. Go figure. So I guess if you want to keep little JoJo out of detention in school, you breastfeed him before he ever gets big enough to go to school, in theory. So IQ scores, the data is plus minus. There's a suggestion that definitely you see an increased risk in preemies, for sure, for babies who are born preterm, that they have higher IQ scores as a consequence of having been nursed. And then there are two sets of data that suggest maybe you got a 5-6 point increase in IQ score, which is really not a big difference in the grand scheme of things overall. So again, your eyes are an extension of your brain. The bottom line is nursing your babies, outside of helping mature their gut and tighten their immune function so they're less likely to get sick, it also affects the brain. Your eyes are an extension of your brain, and your ears not so much, but still, when we're talking about nerves and the whole nine. Breastfed babies have better vision, they have better hearing, and actually apparently these little jokers that nurse from their mamas are less stressed out. Apparently nursing causes stress reduction in babies. Go figure. So that's lovely. We talked about what it does for babies. What does it do for mamas? Well, for mamas, nursing helps with your bounce back game. So if you actually, when you're pregnant, so the lining of your uterus gets nice and thick, this fertilized egg digs into the wall of your uterus and attaches. Part of the tissue is dedicated to becoming placenta, the other part's dedicated to becoming human. That site where the placenta attaches to, after you've had your baby, when it disconnects, there were blood vessels that ran to feed that lining. And so what has got to happen afterwards is the uterus has got to contract down in order to be able to close off the surface where those blood vessels set, and that spot where the placenta was attached on the inside of your uterus has to do something called involute. It's got to actually kind of shrink down and do what it's supposed to do. When you nurse shortly after you deliver your child, it causes his uterus to firm up, decreases your risk for postpartum bleeding, basically. But nursing itself also helps that surface that got nice and thick and fat and juicy in order to support a placenta. It actually helps it kind of heal and go away on its own. Breastfed mamas also, actually breastfeeding for mamas, okay, here's the caveat. This data suggests that it has reduction of stress for mamas, and I will tell you that having nursed all three of my kids, in the very beginning, it is a little stressful, and since we not telling lies in school, if you can survive that first week of nursing, you can do it for the long haul. And in hospitals or whoever you use, if you got a midwife, a doula, whatever, make sure somebody teaches you how to do that latch on the right way, because if you don't get that little human attached to that breast the right way, you will be calling on Jesus and all the saints because of the pain that happens as a consequence of that. The fact that those little humans can kind of grab a nipple the wrong way. With my first child, because I had a bad latch on one side, it's crazy when you have an areola that does this kind of thing, where your nipple's like, it's misaligned, like it's a slope kind of thing. But if you can survive that first week, you can survive anything, and you toughen up and you move on, and the benefits are well worth it. So apparently nursing has a reductive stress effect for moms once you get past that first week where you feel like your nipples are going to fall off and you call it on Jesus. But there's a protective effect for mamas who nurse from the standpoint of postpartum depression. There's some data that suggests that it actually decreases your risk for postpartum depression. Obviously, because you burn some calories when you do it, there's the weight loss enhancement that goes along with it. And we all know you cannot bank on this one. Don't be running to people saying, this lady said that you could go ahead and use this for birth control. But when you breastfeed exclusively, your ovaries are slow to wake up from the coma that they were in. So it does what it prolongs ovulation, or it results in anovulation. So you can bank on it 100% not to get pregnant, but it kind of helps shut them ovaries down, because look at it this way. It's about reallocating resources. I would help you grow another baby, but I'm taking care of this one you got. But again, you can't bank on that definitively for contraception. Long term, nursing your baby decreases your risk for osteoporosis. If you have several bouts at it, you had several kids, you nursed several kids, it actually decreases your risk for high blood pressure and for cardiovascular disease. And if you had gestational diabetes, it will help you resolve it. So 50% of ladies within 5 years, 50% of ladies who had gestational diabetes within 5 years, they actually become diabetics. Nursing your child significantly decreases this, and there's a protective effect for diabetes as a whole. And the last little goodie is nursing your babies decreases your risk for breast and ovarian cancer. And last but not least, the cash you save. So if you are, well, actually not last but not least, the cool thing about breast milk is it is the only, think of it this way, it's like a customized feeding program chock full of vitamins specifically for your child. It changes depending on where you are. So like if you had a baby, say at 32 weeks, and you were pumping in order to be able to make it so that that baby had milk in order to be able to take care of it in the NICU, as your baby ages, the composition of your breast milk changes too in order to accommodate the needs of your child. So that's the cool thing. Formula don't do that at all. Not that I'm bashing on formulas. If that's what you do, more power to you. But I'm all about, well, cost efficient, English words, that's efficient and effective, them two words together. Cost effectiveness was crucial, but even outside of that, because of the thought at the time that it made for smarter babies, and from the standpoint of boosting their immune function, all of my kids, well, the first child was home for a year. I was home with him for a year, but he subsequently went to daycare. My daughter was home, and there was somebody in-house that took care of her, but my son, by the time I had that third child, everybody was in daycare. You got babies that are going to daycare in that time frame that you got home in order to be able to spend with your kids. If you can nurse, it makes a difference, decreases the likelihood of them getting sick by being exposed to the cooties with other kids. Hey, Mercedes. So again, as I mentioned, for ladies who nurse, it saves you about $1,000 a year when compared to with using formula. So that's the down and dirty. Like I said, it's just a public service announcement for the benefits of breastfeeding, as this is National Breastfeeding Month. So that's essentially all I got. I think this is probably the briefest I've been in a hot minute. Hey, Tina. As always, like I say, I love topics, so send me something. I know that there's one I needed to go back and address, and I will circle back. But send me topics. I'm a big fat geek. I love talking about all kinds of stuff. My specialty is obviously girl box things, but send me topics so we can sit and talk about them. Next week, I'll be back on Wednesday. I apologize. I had a rough call yesterday, and I was face down in the covers and could not get it together in order to be able to be where I was supposed to be at the appointed time and day. So thanks for tuning in. Catch me next Wednesday, 7 p.m. CST, where we'll talk about the next topic. Take care until then. Have a great weekend. Bye-bye.